is now preparing to live stream. So again, we never really know what's going to happen. So I'm just waiting for like half of a bar to fill. And we are live. Hello, everyone. This is Dr. Jennifer Gardella. Welcome to our semi-monthly meeting to talk about the wonderful programs that BCHIP, the Bucks County Health Improvement Partnership, is working on. I am honored today to be sitting here with Dr. Marion Moss. Marion, you are very involved with the BCHIP organization as well as health in Bucks County. How are you doing now at the beginning of 2025?
I'm trying to get outside as much as possible. I'm delighted that the chickens are actually laying again. It's a sign that spring is on its way and the warmer weather is coming. But I struggle with that as much as everyone else. So,
Well, not only are you highly educated in the field and work diligently in the field of medicine, you are an ultimate optimist because it's 22 degrees out there.
yeah, but a girlfriend from Penn State came and visited me last week, and I think it was 20 degrees. She lives in Maine now, and
Oh,
we hiked all around Doylestown.
okay. That's
Well,
what
I
you
mean, we
do.
did more than an hour. That's right. Just
That's
like
what you got
go
to
and
get out there.
embrace it. That's right. Get out and move.
Yeah, so why don't you tell us a little bit about yourself, your background, and what you do in the field of medicine?
Well, I was actually really honored to be invited on to BCHIP. So many reasons. I grew up here in Bucks County. I grew up in Hilltown, and I grew up next to farms, active working farms. We knew the people. They farmed our land. The people that create the milk in glass bottles. Right over there in Dublin. So I think Bucks County is a very special place that when we use our resources and we use our local farms, it really promotes health and wellness. I thought it was so funny. I got away in medical school and maybe in residency, people started to talk about local produce and farmers markets and things like that, and those were novelties to the people that I was meeting. And I was like, oh no, wow, I grew up with this,
Right.
Boltons and their fresh turkeys, and growing our own vegetables in our backyard, which is something that I did with my kids. So as we're as as a nation, I think we're starting to talk more about health and wellness. And so that part of BCHIP was really a catch for me. And it's something that I contributed towards in our school district. Our children all went to the Central Bucks School District.
Hmm.
And I spent, I can't even remember how many years on their wellness council. And before that, on the Tohickon Wellness Council. And my son and I helped put gardens in at Tohickon Middle School and in Groveland Elementary, where my kids went. So, it just kind of seems very natural when here we are with BCHIP and we're talking about these blue zones. No matter what happens with our blue zones, and I certainly would like to see us all develop healthier habits, we are uniquely positioned as a county with so many resources that we should be a natural place for a blue zone to form
Yes,
organically,
absolutely.
right?
How very health conscious of you to say that, right?
Yes, yes. But it also, I'm a practicing pediatrician. So
Okay.
the idea of having children, um, it, the kids participate is I think very important, and for them to start doing it naturally as part of their life. It was kind of a strange thing that grew here right in our yard. My own children started growing produce and selling it. I wouldn't let them sell the produce until they were helping, and a great part of it. And then they started a charity project in our backyard, and they raised money for Relay for Life for cancer
Oh,
research.
sure.
When, yeah,
Okay.
one of their friends, one of my good friends' daughters, and then my son, he was very good friends with the sister of a little girl who passed away, and I had 3 rounds of teenagers come learn how to grow organic produce in my yard. And they sold to a local restaurant, and they raised over $20,000 for cancer research. So, but
Wow.
what was remarkable, it wasn't just the money, which was wonderful, but it was the fact that these kids learned a lot about organic gardening, and watching them interact with each other, and then watching them start to understand where their food came from. watching them, some of them that didn't eat beets or tomatoes, all of a sudden just start to try different produce and you know, we're we're pretty experimental gardeners here for them to discover that tomatoes come in more than just red. That was exciting in and of
That's
itself.
big news, right?
Yes, yes. So all of that kind of happened along the way while I was practicing pediatrics, and so there's a lot of crossover, and so there's very natural things that I do in my life that if patients ever ask about good and healthy habits, you can kind of give them some examples. So.
Yeah, sounds like it. And you're very involved with the Bucks County Medical Society. Why don't you tell us a little bit about what they do?
Sure. So every year, since I've been on BCHIP, I think I've been a delegate to the Pennsylvania Medical Society. We're the third largest medical society, I believe, in the country.
Wow.
Massachusetts, the AMA, and then PA Med. So it's a very consequential group. We certainly lawmakers look upon us to help them form ideas or to know what we think as physicians when they're doing, healthcare legislation at the state level. And then we have our House of Delegates that happens every year in
Hmm.
October. And there's so many crossover issues. Jennifer, it's been wonderful to be a part of BCHIP at a time when issues are getting discussed at PA Med because I see other people from around the Commonwealth and their communities. They bring forth resolutions, the resolutions get discussed and then potentially adopted, and then that becomes policy that we can use to help advocate as a medical society. So for instance, BCHIP, we have the local area on aging, and
Hmm.
they're involved with us. And PA Med now has policy that we're promoting caregiver support as we are becoming an aging population. We're recognizing that a lot of that is needed. I'll tell you very personally, I went through that myself. My mother had Alzheimer's, and
Oh,
yeah, it was very difficult for all of us. She was one of those bedrocks of the family, kind of
I'm
bedrocks of the
sorry.
community, really. No, it's okay because it it helps me when I meet patients or people in BCHIP or people at the medical society, and you realize there's so many people that are in their 40s or their 50s that are playing that sandwich generation. But it
Right.
it was a big thing because we had to eventually institutionalize my mother. It's very hard, and it's also like you realize how difficult it is to find a place and then to be able to get the care. We were at least blessed with having resources, so that was a help,
Right.
and she got very good care. And then my father ended up having physical problems, congestive heart failure. Both of my parents had been cared for at Grandview Hospital. So,
Okay.
I go to the beach at meetings and, I see, like, we have our Grandview representatives, and, Grandview was very consequential to me. I candy striped at that hospital. I
Oh,
worked there I know, all this little history no one
what a
knew, right?
history.
Yes, and then I worked there for CHOP for 13 years as a
Okay.
hospitalist. And all that time, my parents were getting care with physicians that some of them are still there. And my goodness, I can still see my father's cardiologist when my father made the decision to stop his meds and to begin the hospice process just because his congestive heart failure, it, he wasn't having a good quality of life,
Oh, sure.
and so he came home and he lived in our house for 3.5 weeks with my
Wow.
children, and, in a hospital bed. And we did have some hospice care and help. But look, advanced care planning is something we talk about at BCHIP. It's something that I lived, and I lived it because my parents were very much aware and thoughtful about what they wanted at their end.
Right.
So,
Yeah. And BCHIP does all of that for BCHIP can come in for it's at no cost to Bucks County residents and come out in and do a lot of that planning and facilitate the hard conversations between family members. So if mom wants, sister one to take care of her or make certain decisions, all of that can be arranged beforehand. And those are tricky conversations, but I think it shows, your vulnerability and willing to take a leadership role in the community healthcare wise that you're just willing to share these stories. I think that's what, people always think, oh, doctors know where to go to care for care, or it's almost easier for you guys because you've been through it, and you're training and whatever. And you're like, yeah, no, we have to, we put on our pants just like everybody else.
hilarious. I would actually encourage anyone who wants, they can go look up my name, Marion, and then Mass, just like Catholic Church, and look up the story about my mother on Kevin MD, because it's one of the reasons that I've become an advocate, because when I realized how difficult it was, even for someone like me that knows how the system works, I,
Right.
I couldn't necessarily always get the care that was needed. And it's a pretty raw story, but I think it's important for us all to know that, we do have to watch our loved ones carefully. So when, as part of the Bucks County Medical Society, I'm a delegate to PA Med, and then we pass reform that is, we're encouraging that caregiver support. I think one of the ways that we can do that is making sure people know what their options are at the end of their lives, and to have those, you're right, they're hard and very sensitive discussions with family. But, to tell you the truth, we still reflect on those times, as hard as they were. And, my children saw it at very formative times in their lives.
Right.
In the beginning of ninth grade, the beginning of seventh grade, and fourth grade, they were young, and they watched my father make that very conscious decision. And I think it's like, we're all a little afraid of talking about death because it's the unknown. We're all going to go there someday.
For
Like,
sure.
let's have the end of our lives be a time when we have choices, and maybe some control, and a death with some dignity, and some of the things in it that we want. It's interesting. We just had, my brother and I got together, and my children, when my father lived on hospice, they they did a recording of him. A friend suggested it. They asked him questions. I mean, he was facing the end of his life, and they interviewed him, and it was just so meaningful. And we
Hmm.
all watched it over the holidays. I didn't mean to get off onto
Aw,
that topic, but you know how these things are.
right. And
They
that's
have no
also
dentistry.
one of the things that BCHIP is working very hard on. You said it, the aging population of Bucks
Yeah.
County, and who is going to be there to take care of some of our most of our seniors. And we're seeing issues with things like staffing care, right? Like
Mhm.
where are the aides going to come from? The county has put money into training of aides and other workers in these systems. So it is an issue that needs to be addressed now, so that when we do have the bubble that happens, there's places for these people. And what your family did was amazing. Not all families can do that. So we're all, those of us that may not have family that we can just go live with, where are we all going to
Right.
go? It's big decisions that need to be made. So so the Bucks County Medical Society has a hand in BCHIP. What else do you guys work on over there?
Oh, so I mean, the medical society, it's really like all fair game. Some of the other resolutions that we passed this year, there was a lot of discussion about the medical society. I guess the original resolution was to come to a neutral position on recreational marijuana. We
Hmm.
didn't come to a neutral position, but what we did come to is that we would be monitoring the public health effects in other commonwealths and other states regarding recreational marijuana use. I mean, and look, we all bring our experience into this. I mean, I think I'm bringing my experience into it as a mom, and a mom of recent college graduates, a mom that, it isn't that long ago that my children were in sixth and seventh grade and telling me, look, some people are starting to smoke. And, I'd go hard to the mat that it's not necessarily a great idea to experiment too much with, sucking something into your lungs, that whether it's by vape or a cigarette recreationally. I don't think it's doing a great service for the youth of our commonwealth or our nation.
Right.
I'm not disparaging the fact that there might be some medical benefits. Those things need to be teased out, and studied, certainly. But so the fact that we're looking at the public health ramifications in states where marijuana is legal, I think is really important. I mean, it
Yeah,
just,
and
yeah,
oh, I was just going to say, no matter where you sit on any of these issues, I think what needs to happen is the conversations. The more we can
yes,
talk about it and start to learn, it's that old high school or college exercise. Once you start to talk about it and you can actually talk about the other side's point of view, now we understand it on no matter where you sit. And that is what is so critical. So it's involving, public people like that are not doctors. It's involving doctors and lawmakers, and how is all on any issue, how is all of this going to work?
A
That's what's so
hundred
important.
percent, 100%. And, once again, you see the crossover. I mean, certainly it's not, it's pretty well known that marijuana can serve as a gateway drug for other
Yeah.
medications. Once again, here we are with BCHIP, where, it's one of the big issues we confront. I mean, how amazing we have this warm handoff program so
Ah,
that if patients come in with those overdoses, they have at their disposal the option to talk to someone who was trained and who's a former substance use disorder sufferer. So someone who went through a program, and got themselves clean. And, don't we, none of us should be fooling ourselves. I mean, I have friends that have lost children.
right.
I
Yeah,
have family members that, have suffered. And, there's people in my profession. BCHIP had an amazing event where we had a former local surgeon come and talk about her addiction, first
sure.
to heroin and then after that to alcohol. And, these are big topics. I mean, the alcohol topic, I think, is set to take off for a national conversation. We just heard from the Surgeon General on that, and it's causing quite a stir. I'm sure my Irish grandmother might be rolling over in her grave and wondering how she
Possibly.
lives 94 with a Manhattan every day. The,
Right.
the Italians doing their red vino all the time are like thinking, no, no, you can't say that it's all unsafe. But then we also do have to acquiesce to the fact that there's a lot of health problems that can be caused, by alcohol. So,
Right. And
uh,
like you said, it's a gateway. So it's really important. And, Kim Everett, who's the executive director of BCHIP, and I know the BCHIP board, very, very supportive of all of the addiction all of the addiction services that are available in Bucks County, no matter where you sit in, whether you are the one that is suffering and certainly struggling, or even if you're one of the caretakers or you're about to exit someone's life because they're struggling. There are so many resources available. And so at BCHIP, we try to get as much of those out on a regular basis as possible because that's what it's,
yes. Yes,
all
and
about
actually,
awareness.
recently the whole issue of substance use, especially with the OxyContin, it was brought up. I believe it was on the front page, but I know it was in the New York Times. But I think it was the front page. Um, One of my big advocacy topics that I deal with, not as much with the Pennsylvania Medical Society, although we do have some policy around it, but these pharmaceutical middlemen, they're in the news everywhere now. You know, uh, I do a lot of work in Washington, D.C., and I've been writing about the pharmaceutical middlemen since 2018.
Okay.
And when I know it's going back quite a ways, I'm pointing out, look, there's these middlemen. They're not making any drugs. They're not doing any research. They're not even moving the product. Like, you know, they're not warehousing and moving the product around the company. They're
Right.
simply writing contracts like a bunch of bookies. And I'll say it just like that at DC meetings and Harrisburg meetings. I think people are sometimes taken aback with what I call a direct approach, but um, these middlemen, they get to receive kickbacks. And as it turned out, the makers of OxyContin, Purdue, were paying big time kickbacks to the biggest of these three middlemen. And someone finally thought to look under the hood of that and discover that maybe this is how the OxyContin ended up, continuing to get distributed, because it was on formularies and it was getting coverage. It's great to have things covered by insurance companies, but if people are making decisions about what gets covered and they get paid by the pharmaceutical companies, are we getting the best drugs, the needed drugs, or are we getting the best drugs that kickback can put on the formularies?
Yeah, and that's been, the subject of many a Hollywood story, many a news story across the nation for years. So it's nice, though, to hear that someone with your background experience, your education, is also still diving in there. Because, we really don't need to take our educational, what we as a society know about these issues from Hollywood. It's,
No, no.
so that's an issue. So why don't you talk a little bit about BCHIP? Why do you think it's important to Bucks County? And what do you think is coming down the pike as far as initiatives?
You know, um, Bucks County, and I can say this going all the way back to when my family moved here when I was one, so now we're talking back to 69, and now everyone knows how old I am. Whatever. I'm over it. We all tend to.
Right.
But it's been a community where people work together. I think back. to my mother, who she did a lot of work with the libraries in Bucks County. She saved the Percy Library, like literally, they said there was going to be no Percy Library, and she stepped in. But she worked with, community members, people that worked at the local banks and people that were local philanthropists, and she had contacts with the newspapers, because I played tennis, we were in band, she always like made it her business to know people, right? So doing BCHIP, it feels like a very natural thing that you would get to know the people in your community. Now, of
Okay.
course, BCHIP is a much wider net than Hilltown and Percy, right? So I feel like I am always learning more. But I'll give you another example. Nova, one of our
Hmm.
BCHIP members, right?
Sure.
So our daughter actually worked for the Nova thrift store throughout the pandemic, and she did her summers when she was off of college. And she actually now she has to do volunteer hours in dental school, so she's going in and she's volunteering. And she left like a week and a half ago. I kind of missed her, so I stopped in to say hi to the Nova ladies. They missed her too, and I was like, they're like, "What are you doing here? You're doing another day. I know you were going to volunteer when Amanda was here." And I'm like, "Well, yeah, but I kind of miss her. I thought I'd stop over and see you." So, Penny, the executive director of Nova, came in, and Penny and I were talking, and she does such phenomenal work uh, at Nova with getting education to people so that our local hospitals, when women are victims of crime, we can have some forensic exams done. I mean, it's invaluable work, very delicate work. What a boon that, it's less than a mile from me, the Nova thrift store that helps fund Nova, right?
Hmm.
So proud of those ladies because they are generating, I think it's more than $1 million a year. And they're actually also helping the community at the same time, all
I
kinds of
love a good
people.
thrift store. Love
Yeah,
a good thrift
well,
store.
I'm here to be the advertisement for Nova Thrift Store because you can't believe what comes into that
I
place,
know I've gotten
right?
some really good stuff up there. It's a good one. That is
Yes,
a good one.
absolutely. And you're also helping, victims of crime. You're helping to make sure that at our local hospitals across Bucks County, that hopefully there's some experts that are trained in how to take care of women that are victims of crime. Because we talked about the overcrowding, right? Our ERs are all overcrowded because we have the mental health issue, right? And
Right.
so they're overcrowded. So they may not have the time to have another expert to be able to come in and handle a delicate problem. What a what a wonderful thing that is for, our local ERs who
Yeah,
are
same. And just
struggling.
like what you brought up with bee cares too, like that's the
Yep.
work that we need to do across the community, across hospitals, who are all, I've interviewed, some of the hospital leadership on these types of calls. And, they will say BCHIP is there, even though they all are technically competitors of one another. They want to work across the issues because they can learn from one another, and there's no need to reinvent the wheel when things are working. It's all about the health of the community, which I think is really a beautiful message.
Yes. Yes, it certainly is. So,
Well, Marion, you have given us a wealth of information, not only on, the Bucks County community. I'm very informed now. I learned a lot about what's gone on here because I'm a relatively new person, to the area. But thank you so much for your expertise and how you care. And if your kids start selling vegetables again, please let me know because all
no,
about.
what will happen is if you're really smart, like maybe around the beginning of August, you'll ask Kim if we can have a meeting at Marion's house, and you'll come up and you'll get to do a tomato tasting. So
I'll
let's
bring the olive
go.
oil.
All right, I'm in.
Well, thank you very much. We are looking forward to you coming back again in the future and get out there. I will be also thinking about your chickens that are like you said, the chickens are getting ready because it's spring. I think that might have been when we were talking before the call started. So we'll be looking forward to that as well.
All right. Thank you so much, Jennifer. Thank you for what you do.
Thanks.